For many years, common practice in medicine meant that doctors made decisions for their patients. There's a traditional view that by doing this, they're doing what's best for them. However, a contemporary view endorses a paradigm shift geared towards involving patients in every decision that is taken. Well, the realization or the paradigm shift is anchored by the evolving medical ethics. By medical ethics, I mean the moral principles that govern the practice of medical doctors or other healthcare workers. These medical ethics clearly says that it's of paramount importance to respect patients' autonomy, to acknowledge the fact that the patients can make their own decisions and they can take actions based on their own personal beliefs and values. It also clearly states that it is important for you to respect the patient's rights to freedom, confidentiality, and privacy. Furthermore, it is important to understand that this is the guidance for medical doctors, the medical ethics. So whatever practice that you do, you have to be guided by medical ethics. But central to these ethics is the issue of informed consent. It is very important to make sure that the patient understands the treatment that is offered to them. So informed consent is an autonomous authorization of an individual to a medical intervention. So that's basically what it means, the informed consent. So it's important to make sure that the patient understands what is offered to them. So in deciding on which case which must outweigh the other, you must be guided by the medical ethics. Let's make an example in this issue of medical ethics. One issue is when the patient refuses treatment. Say they refuse blood transfusion or organ transplant. The reason might be due to religious views. So in the patients that are Jehovah's Witness. So it's very important to understand why they're refusing the treatment, and if they've been explained properly why is it important. So one can say that the patient fully understands the importance or the urgency of being given the offered medical treatment, but they still refuse. So the obligation as a medical profession has been fulfilled. So there is no hard or fast rules when deciding in these cases. So you basically have to understand the reason why the patient decides to the decision that they decided to. So it is very important to understand that by advocating for patients' rights, you're also saving lives. So these two have to complement each other at every given point.